More than 100 patients were put at potential risk of harm due to inadequate supervision of disgraced surgeon Sam Eljamel. That's according to an internal review from NHS Tayside, which found concerns about the former head of neurosurgery weren't acted upon. It sparked fresh calls for a public inquiry into exactly how he was allowed to operate after he left his patients with life-changing injuries. Well, for more on this, Callum Clark is outside Nine Wells for us. Callum.
So Andrea, this is the report that was published today by NHS Tayside's medical director ahead of a public meeting, and it's the latest in a long list of reviews into Sam Eljamel, the man responsible for multiple botched operations, some as horrific as removing a woman's tear gland instead of a brain tumour. And some of his victims have today said that this doesn't go far enough. It doesn't get them the answers of how he was allowed to keep operating despite the health board being aware of concerns. And that's what sparked fresh calls today for a public inquiry.
There are MSPs across all political parties who think that there should be a public inquiry, and I think the public think that there should be a public inquiry, and certainly the patients do, because under oath, people who were involved in this terrible process will have to give evidence.
The reason why I've said I think an independent commission is the right way forward as opposed to, for example, a public inquiry, is we think the independent commission is suitably independent, which is important, but equally can get people the answers to the questions they need in a quicker time frame than, for example, a public inquiry would.
So Callum, what did the review tell us?
Well, it provided an admission that NHS Tayside didn't adequately monitor Eljamel when he was placed under supervision, allowing him to carry out operations on 111 patients between June 2013 and December 2013. It also found that a proposed review into Eljamel was actually dropped when he announced his intention to retire. Now, he's since left the country. He's last believed to have been working in Libya. Today, NHS Tayside issued an apology to his victims, some of whom have been left paralysed and in constant pain. But their demands remain the same: a public inquiry to get more answers.
Callum Clark in Dundee, thank you.